In 2006, we started with a quad approach for this sort of patients, because up to this moment, for the patients who don't have any bone at all, we were using graft approaches combined with zygomatic implants. And I was willing to leave graft approaches for these sort of patients for many reasons, because the acceptance rates were very low and the treatment was very long. So we started with a quad approach using immediate loading, and we started with a prospective study, and we demonstrated that the quality of life of this patient is normal after the treatment. It's not an improvement in the quality of life, it's a normalization of the quality of life.
"94% of the time, we are able to stabilize the implant at the maxilla as well as the zygoma, and that takes the stress off of the zygoma bone and the implant itself tremendously. The quad zygoma is really the end-stage treatment. Quad zygomas are usually considered after multiple implants have been placed and failed, and possibly bone grafts have been placed and failed, and there's no other option. These patients are the extremely compromised patients. We can reconstruct them, but the post-operative instructions on dietary restrictions, on the continual follow-up they have to have with their dentist to make sure that the prosthesis is absolutely cross-arch stabilized is critical. So we give them nice teeth, they look nice, they're not worried about their dentures falling out, but when it comes to eating hard foods and such, they have to be educated.
The main finding is that nobody discusses the effectivity of this technique for this sort of patients. This therapy has been controversial for many years. Everybody recognized that it is a very fantastic tool for the treatment of this modality of patients, and I think it is the most important finding. I am surprised to see the acceptance of this therapy today in the world, but it was not like that for many years.